sometimes we hear these terms colitis, like ulcerative colitis and Crohn's disease. First off, what is ulcerative colitis? Was it a common thing?
Well, let's start with the term colitis.
Okay.
In medicine, everything ending in itis means inflammation. So colitis is inflammation of the colon, which is the last part of the intestine. It's like the sewage of the intestine, really where the fecal matter is formed, organized, and stored. So there are different reasons that the patient may have inflammation of the colon. The patient may have an infection, for example. In the majority of these cases, the infection is transitory and may last for days or weeks. And then, obviously, the inflammation may produce diarrhea, sometimes passage of mucus or blood in the stools, and crampy abdominal pain. The other condition that you are mentioning is ulcerative colitis. That's a chronic condition that is going to last for years. It's a condition that makes part of a group of diseases called inflammatory bowel disease. And ulcerative colitis is a condition that we don't know exactly what is the cause of that problem, but probably is due to the interaction of some genetic factors, some environmental problems, probably certain bacteria may be involved in that, some particular enhanced immunological and inflammatory response from the part of the host. And the consequence of that is that the patient is going to have persistent inflammation of the colon.
If we suspect it, how do we diagnose it?
Well, again, medical history is going to be very important. Patients presenting with ulcerative colitis may have a history of a variety of problems. Common problems include abdominal pain, some recurrent chronic episodes of abdominal pain of variable intensity. The patient may also have bouts of diarrhea with the passage of blood in the stools or mucus sometimes. Common manifestations of these problems, particularly in children, are the consequences upon the growth of these patients. So patients with chronic inflammation may present with delay in growth or with decrease in the weight.
What age usually is it diagnosed by?
Well, these conditions of ulcerative colitis and the other condition that belongs to inflammatory bowel disease, it's called Crohn's disease, typically have their peak in the second and third decade of life. But certainly we have diagnosed, as other gastroenterologists, the conditions very early in life, in the first, second, or third year of life.
And if we do suspect it, we make a diagnosis. Is it treatable?
Yes, certainly. The diagnosis is going to involve a series of tests, including X-rays and endoscopies and taking biopsies. And yes, the condition can be treated with different products to decrease the inflammation. The first really goal of the treatment is to subside the symptoms that they are very acute and producing tremendous discomfort of the patient, like the diarrhea, the pain, and other type of complications. But certainly, once that we improve the flare-up of the colitis, commonly we give to the patients medications in order to maintain the remission of the condition.
Do they end up with surgery sometimes?
Occasionally, the patient may need surgery. One of the complications of ulcerative colitis is massive, unstoppable bleeding. And when that occurs, the condition may be severe, the patient requiring blood transfusions. And if the problem persists in despite all our effort with treatment, medical treatment, certainly the patient may need colectomy. In other words, resecting the colon of the patient. Another interesting aspect of the surgical treatment for ulcerative colitis is that ulcerative colitis is a condition limited to the colon of the patient. Therefore, later on in life, we tend not to do that in the pediatric age group, but in the adult age, the patient may have removal of the colon and then being cured of the disease. It's important also to take into account the fact that one of the potential complications of ulcerative colitis and long term is the possibility of presence of malignancies in the colon. Therefore, the importance eventually of considering the surgical treatment with colectomy subsequently in life. But this is, again, a decision that for the most part we pediatric gastroenterologists in the age group of patients that we treat, we don't have to do.
If you remove the inflammatory section of colitis, the risk of cancer goes away?
Yes, because there is not going to be inflammation in the colon, therefore a persistent inflammation is one of the conditions that may facilitate the onset of malignancy.
But there's another inflammatory bowel disease called Crohn's disease.
Oh, yes.
How does that present?
Crohn disease is a similar, but at the same time very different disease to ulcerative colitis. We have said before that ulcerative colitis limits itself to the colon, whereas in Crohn disease the inflammation may occur from the mouth through the anus of the patient, and commonly involve the small bowel, particularly the terminal part of the distal part of the small bowel, in a section of the small bowel that we call the ileum. Another aspect that is different in Crohn's disease compared to ulcerative colitis is that the inflammation in ulcerative colitis occurs in the inner lining of the intestine. It's rather superficial, whereas in Crohn's disease, the inflammation may go through and through the whole wall of the intestine. And therefore, one of the potential complications of Crohn's disease is the formation of fistula. In other words, false communication between intestinal loops and sometimes communication between the intestine and any part of the body, skin, like the abdomen or in the perineal area.
What we talked about before, ulcerative colitis, you just remove it, you get rid of it. But Crohn's disease, you don't remove it, do you?
Yeah, unfortunately, the removal of inflamed portion of the intestine in Crohn's disease is not curative because, again, the inflammation may occur in any part of the intestine. So a patient may require surgery as part of the treatment of Crohn's disease because one of the complications of this inflammation, which is quite severe in the intestine, is the presence of strictures. The formation of a scar in the intestine that really may occlude completely the lumen of the intestine, and therefore there is going to be a lot of difficulties passing the intestinal juice and the food through the intestine. Therefore, in such cases, if the problem doesn't improve upon receiving the appropriate medical treatment, the patient may need surgery to have a resection of that portion of the intestine that had that scar, that stricture.
But Crohn's disease is treatable with medication?
Certainly it's treatable with medication, and again, similar to ulcerative colitis, we have medications to use as part of the treatment of the acute flare-up of the condition and medications to maintain the patient on remission.
Thank you very much.